Chronic lymphocytic leukemia, or CLL, is a cancer of the immune system. Let's begin by discussing the cells that become leukemia cells. The immune system is a remarkable defense system made up of many different cell types organized to have very specific roles in detecting and ridding the body of bacteria, viruses, and other unwanted invaders called pathogens. One of the key immune cell types, called B lymphocytes, are made in the bone marrow. From there, they travel to the spleen and lymph nodes, where they mature and start making antibodies. The normal growth and development of B lymphocytes are critical for effective immune function. In a healthy body, normal cells have a standard growth and death cycle. They don't live forever. When cancer develops, it can hijack that cycle, allowing cells to divide uncontrollably and unchecked, and to actually become immortal. Leukemias occur when abnormal cells in the bone marrow start to divide uncontrollably and can even crowd out the healthy cells. The specific type of leukemia is determined by which cells are altered and how fast that process occurs. Chronic lymphocytic leukemia affects the B lymphocyte population and in many cases develops slowly, sometimes taking years to become serious. This is in sharp contrast to the acute leukemias, which develop much faster. When CLL is first diagnosed, your doctor will determine if you need to be started on treatment right away or if your CLL may be safely observed over time. Not everyone will require immediate treatment. If you do require therapy, CLL can be treated by any number of different classes of drugs depending on the severity of the disease and the age and the health of the patient. Your healthcare team will weigh the benefits and risks of each treatment with you to make the best shared decision based on your health, disease status, and personal preferences. To assess the effectiveness of your treatment, especially if you are enrolled in a clinical trial, your doctor may elect to test for MRD, or minimal residual disease.
Hello, I'm Dr. Prime, and I'm here today to help you understand MRD and how it can impact your treatment.
Thanks, Dr. Prime. I have a few questions for you. What is MRD?
MRD is the lowest measure of detectable disease, one leukemia cell in 10,000 leukocytes, or white blood cells, with tests currently used today.
How will you assess MRD?
MRD can be measured by either a blood test or by performing a bone marrow biopsy. Your doctor will request a simple blood test to start. If your results come back MRD negative, meaning that there were no detectable CLL cells in your blood, he or she might request a more invasive bone marrow biopsy. This is a more sensitive method of detection because CLL cells are formed primarily in the bone marrow. If that test comes back MRD negative, then you have no measurable disease.
Why do I have to come in for so many tests? Why not start with the bone marrow biopsy?
The bone marrow test is more invasive, and depending on your treatment, MRD may be tested at multiple stages of treatment. Testing your blood first ensures you don't have to undergo unneeded procedures, like another bone marrow biopsy.
What happens if either of the tests come back MRD positive?
If either your blood or bone marrow come back MRD positive, that means you still have detectable CLL cells. Your doctor will talk with you about this and will take your MRD status, previous treatment, and disease characteristics into account and determine if a change in therapy is needed and what the best option would be.
What does the MRD status mean for my prognosis?
Some studies have shown that patients who achieve MRD negative status in their treatment may have a much longer effective control of their CLL and a better overall survival compared to those who do not achieve MRD negativity.
Thank you, Dr. Prime, for your help today.
You are certainly welcome. I hope this has helped you understand MRD status a bit better.
We hope this has been useful to you. Please take a moment to give us feedback.